Hi, everyone. Today I'm extremely excited to be talking with a friend and colleague, Dr. Qazi Javed. Dr. Javed is a double board certified child, adolescent, and adult psychiatrist who is trained in integrative medicine and herbal medicine. He has a private practice in Austin called Integrative Psychiatry Austin, where his team includes a PA, acupuncturist, herbalist, neuropsychologist, nutritionist, therapist, and a health educator all in one place. His practice also offers ketamine-assisted psychotherapy and functional medicine services. His team considers their work sacred. They believe in healing rather than symptom resolution. They integrate various modalities, work as a team to assess and then treat. They assist other people in healing themselves, and this puts people in control of their own treatment choices. So, Dr. Javed, thank you so much for joining me and giving me some of your time.
Absolutely. It's a pleasure to be here. Pleasure to be here.
Yeah, we've had such good conversations previously, and I look forward to having another one. We have talked about depression and mental health at a great deal. So that's what we're talking about today. But first, I'd like to know a little bit more about your journey into medicine and more into mental health and the functional medicine space.
Right. Well, so please stop me when I start talking about myself. I talk a lot. So I did my medical school in Pakistan, and then I moved over here to US, and I wanted to go into psychiatry. I had seen a lot of psychiatric kind of things growing up, people around me, and so naturally I was thinking in that kind of a mode from early on. And then when I went into psychiatry, then at that time, then I decided that I wanted to do child and adolescent psychiatry as well. So I trained in that. I trained in UW Madison, and then after that I went to University of Iowa. Which was it's a historically very biological program, so it's very medicine oriented, but getting to learn child psychology, I had a chance to start getting interested into psychotherapy and how human beings develop, and then that coupled with my own journey of trying to figure out who I was in this world, what is my purpose in my life, what are the things that move me, I went more and more towards some of the, started from psychoanalysis, but then slowly moved over to existential kind of work, existential psychotherapy. And along the line, I found out after about 5 years of practice after residency, I found out that the medicine that we were using was not very effective. Yes, it could be effective. It had its place, but it was not the thing that all healing and everything needed to be based off. So, at some point in time, I decided not to market for things that were being marketed by pharmaceutical companies or algorithms that were being marketed that were supposed to be the only treatment that were to be provided. I did not like the split that was happening between psychotherapy and the conversation and the recognition of another human being and a human purpose, and boiling it down to reducing it to medicine only.
Right.
So at that time, I started exploring some other healing modalities that might be out there. So I discovered functional medicine, herbal medicine, traditional Chinese medicine, Ayurveda, and then as time went by, spiritual medicine, and so it's been a journey for me, and continues to go on.
Yeah, that's a fascinating background, and I think you are at that place which is so interesting between mental health and the sort of the spiritual and the more untangible things. And I think modern medicine has broken those two things as two separate entities and ignored a lot of the spiritual side of things, which I think is overall very detrimental to healing. And I think you felt the same, and so you have done a really good job of merging the two together for yourself, but also for your practice. And I think that more people, especially more mental health professionals, need to be aware of those two things, because now all the medicine we practice is this kind of reductionist type of medicine, the chemical imbalance, the neurotransmitter, and we know all these things about the body, but we are also, like I mentioned in the introduction, missing out on the sacred, and that's something that you're trying to do in your practice. So I really appreciate you taking that approach. So I want to go ahead.
No, absolutely. I think you're right. At some point in time, the reductionist model, it makes us believe that medicine is something that we are giving to someone. The truth that I've discovered is that I am the medicine. The person who is talking to me, that person is the medicine. They have the medicine. So, when we have to integrate those two things within ourselves, because if the medicine has to be integrated to provide healing, then you have to integrate yourself if you're to provide or be a conduit of healing. I don't think people can provide healing, but
yeah, it's a matter of perspective about what you think about that pill or medicine or whatever you're taking, and how you view that in conjunction with the entire picture, I think. So,
absolutely.
Yeah. So I wanted to talk about depression specifically, and we are now in this big epidemic of depression, maybe a pandemic of depression. We have had this COVID pandemic, which has only made things worse for anxiety, depression, loneliness. So I wanted to see if you had any thoughts around why you feel the rates of depression are increasing. We obviously know the pandemic had a lot to play, but even before that, there was a huge amount of mental health crisis going on. So what are the main factors that are contributing to the rise in depression?
So many. And, we can be the, that story about like what do they call it? The blind men of Hindustan, right? Like where there's that elephant and these blind people go, and then one says, well, the elephant looks like a big solid foot, right? Like somebody's touching that elephant's foot, and somebody's touching the trunk and says, the elephant is like a snake, kind of, right? And so depression also, it just depends on what kind of a perspective you take. But in general, I think especially with this COVID, and since we're already talking about that integration piece, so lack of integration will cause depression. Lack of integration will cause polarization, and the polarization will cause depression. So if there's one existential yearning that everyone has, that is to integrate themselves, is to become one, whole, right? And hopelessness about not being able to be whole is depression.
Okay. And for those that may not understand, what do you mean when you say being whole? What are the components there?
So being whole would mean that that there are different parts of an individual. Like there's the biology of that individual, and then there's the psychology of that individual. There's the spiritual nature of an individual. When all of them become whole and become in line with what a person's life goal is, what a person's ambition is, what a person's purpose is, when all of those things work in unison towards that thing, then there's no conflict.
Right.
So being whole is like being completely pointed, channeled towards one source.
I see. So I think we can say that the modern world and the way that we live is starting to compartmentalize these things, and oftentimes focusing maybe on the biology of an individual and ignoring the psychology a little bit, but mainly ignoring the spiritual nature of a human being. And that we've known for thousands and thousands of years about the spiritual nature of human beings and how important that is. But the way that we live in the modern world and in our modern lives, there is a distinct break from that. And so I think there's there's not a lot of things that are conducive to improving our spiritual nature, to even being aware of our spiritual nature in the lives that we live. So
well said.
Yeah, I think that's the biggest problem, and I think that's what you're sort of vocalizing. So the rates of depression are so high, and we have people that are continuously struggling in that journey to more wholeness. Let's say what you were talking about, to be whole towards one source and one path, and for all their components to be very just in line with their purpose. And so when that leads to depression, then they're presenting to doctors like yourself, myself, other health professionals, and they're then being treated. Now, the way that they're being treated now, conventionally, is, and this is a big part of what I wanted to speak about, is the models of depression that we have created, and that's been around for some decades now. And the biggest one is the chemical imbalance one, which is a very popular idea that simply depression is caused by an imbalance of neurotransmitters and chemicals in the brain. So someone who is depressed has low serotonin, low dopamine, and if you have made the cause the neurochemical imbalance, then the solution is simply to improve those levels, and that's where our pharmaceutical medications come, and those have been pushed very heavily. And this is great timing to have this discussion, because they just came out a few months ago with that meta-analysis where they reviewed the entire literature, and I will link to that paper, where they really questioned the serotonin theory of depression, and found that through this meta-analysis, that the evidence did not support that theory, where yes, there might be certain imbalances, but a simple explanation that serotonin is causing depression or low dopamine is causing depression is really falling apart. So I wanted to speak to that, why there's such a mismatch between the evidence we know and we see, and between the practice out there of treating depression as a single modality issue.
That's a great question. So I think there's definitely a lot of healing that I've seen in medicines as well. Right? So whether we have the correct reason for it or not, whether it's the serotonin or not, some of these medicines do help.
Sure.
They save lives, they help us practice compassion sometimes. But the theory, you're right, it kind of falls apart when you look at it very closely. So why is it that these medicines are working sometimes, not working other times, and we really don't know what is going on in the brain with them? So, whereas it's an admirable kind of a thing that we are trying to isolate things so that we can reproduce them again more consistently on a larger basis. So we're trying to establish cellular mechanisms of various things, and it's amazing. But practice of clinical medicine sometimes involves so many other factors that sticking to that thing that we don't yet know about and basing all clinical decisions based on that can get us into problems.
Yeah.
So I don't know what is going to be the end result of why antidepressants work, right? Is it because they work with the serotonin system? Once COVID happened, we started realizing that some of these antidepressants have anti-inflammatory actions as well.
Yep.
Do they work because of that? Do they work because of the cytokines? Do they work because, maybe 20 years down the road, we find out these SSRIs, they used to have like some kind of an effect on our energy body. Who knows, right? They do have an effect on, like the electrical markers in the brain, EEG, right? So, so if they could have that, then could they not have that, right? is our model of disease just based on molecules? Is it deficient? It might be. But at the end of the day, I think the biggest thing that gets us into trouble is the arrogance that we know the most right now than our past ancestral lineage.
Right.
That we know more than them. We might know more than them in some things, but, taking away wisdom, taking away all of those kinds of things away from them and saying we already possess it because we are a scientific nation and we see the world in a particular type of a way is arrogant. And we suffer for that arrogance. So going back and turning back towards some of those healing kind of things that have always been there, utilizing them, that makes a lot of sense.
Yeah. I think there's this idea that just because we are progressing in some ways means that we are just entirely progressing from our past and, we're in so many ways just better than things were back then. But in a lot of ways, when you talk about more ancient wisdom and things like that, we've actually regressed and lost a lot of those principles, then gained them, although we've gained scientific advances, technological advances, things like that. So, it goes back to what we were talking about earlier about the reductionist idea of care. When different industries are involved, like the pharmaceutical industry and other industries are involved, then it's very difficult to say that depression has a multifactorial cause, because if you say that, then you need to then treat it in a multifactorial or multifaceted way. Then you need a clinic that has, things about diet, nutrition, lifestyle, because those are all things that are associated with depression. And so then I think when these different industries are involved and they have their different interests, then it does benefit them quite a bit to have a simple explanation of depression. Because if you have a simple explanation, then you have a simple treatment. And it's just remarkable to me how we just continue to go along with this. Most Muslims, or most, not just Muslims, but most people have this idea that depression is a chemical imbalance. And with that, they have bought into this idea that they need antidepressants. And they will even know that, for a lot of these people, antidepressants may be not working well, may be harmful, may increase suicidality. But because we've been trained so much that this is the cause of depression, then we have this mindset that we need SSRIs or antidepressants to improve our depression. So I think that it just, when you look at who's involved and what's involved, then you can start understanding where the background of some of these things come about. And it's widespread in all of medicine. Whatever you talk about, the idea of having a theory about something, even though it's completely wrong, but sticking to that theory for decades and decades. We've seen it in nutrition with fats, and we've seen it in women's health with these oral contraceptives, things like that. Just like that, I think SSRIs and antidepressants fall into that same category. So this is an interesting observation.
They do. That's so well said. One thing to so the antidepressants might work. Statistically, they might work for X amount of, percentage of population. That's good.
Yeah.
What then?
Yeah.
So they might help energy, they might help sleep, they might help
inflammation,
positive outlook, inflammation, they might help. But what then?
Yeah. What else? I think that's a very good question. And so, before I ask my next question, I was going to just mention to people that while we have this theory of chemical imbalance, and that is, we are seeing it being more outdated and it having some more holes poked into it, we also have this theory of, or this model of, inflammation causing depression and causing mental health issues. And that comes from a understanding that there's a close connection between the gut and the brain. And this is not just a, kind of a hypothetical or something like that. It is an actual connection, a physical connection between the gut and the brain, where we know that signals go down from the gut to the brain and the other way around, so that dysfunction in one of the two can cause dysfunction in the other. That's why a lot of people say when your gut is on fire, then your brain is on fire, meaning when you have inflammation in the gut, then we have seen through MRI and different studies that you will have inflammation in your brain, and those inflammatory mechanisms are what is oftentimes responsible for depression, lack of motivation, lack of executive function, cognitive decline, neurodegeneration, Alzheimer's, a lot of these things. So there is an inflammatory basis to all these things. And I think that where antidepressants may work is maybe through some of those pathways. So we know that they don't work through the serotonin pathways, perhaps, but they work more so in the inflammatory and other pathways which we may not know about.
Absolutely. So, absolutely. And, even like our body is alive, right? And for example, our heart. When our heart is beating fast, does that cause anxiety to our brain, or does the brain cause anxiety and make the heart beat fast? Our heart is an electric system that is autonomous, that works by itself. And in traditional Chinese medicine, they call it the seat of Shen, right? Like where, and trauma can affect that. So some of the herbs, some of those kinds of things are actually targeted towards the heart.
Right.
And they can calm down the mind as well. Similarly, even muscles, for example, you work out, you have cytokines that are released that are anti-inflammatory, that are increase BDNF, like the brain-derived neurotrophic factor in our brain. Our body it's just so alive, and there's so many inputs that we get of how we feel. Yeah, most of the serotonin is not in our brain, actually.
Right. Yeah, most of it is in the gut, which people don't realize that, but it's been popularized that most of it is in the brain. So,
or in our blood cells, right? In our platelets.
Right. Yeah. So you're absolutely right, and the heart connection is very interesting because we also know now that you can literally, when you mention trauma and emotional, major stressors can literally cause your heart to go what's called Takotsubo cardiomyopathy, or you can have just heart failure and die as a result of a major emotional stressor or event. And so there's a very close connection between what we go through psychologically, emotionally, spiritually with our physical being and body. So certainly very interesting.
Totally.
So I wanted to ask, now you have in your practice this integrative model, holistic model, where, like I mentioned in the introduction, you have so many different modalities and people working together. And so what are your thoughts on how that is a better approach to dealing with depression and mental health issues more broadly?
So it just offers people a chance to be able to get all those services under one roof without having to secure them separately. Yeah, and they can. Some people do secure them like by themselves, but then communication starts becoming a problem. So these are all those things that. So before I opened the clinic, I was practicing integrative medicine for some time, and these are some of the things that were coming up, right? And we continue to try to evolve, and so communication then became a problem, right? Like, so the acupuncturist has, for example, seen the person and done a traditional Chinese medicine or a pulse diagnosis on the person. How is that relevant to the therapist who sees the person?
Right.
How is that relevant to the learning disorder that the child has, for example? How is that relevant to some of the substances or behaviors that a person is using to numb themselves? How does that affect the self-esteem? How does that come out in how a person is giving themselves love or nutrition, right? Nutrition is love to ourselves, right? Like what is that? So when you can do all of these kinds of things and be able to collaborate on it, then it takes a team approach rather than a patriarchal approach that medicine has, that I am the doctor, I tell you to do this, you go do this. Yeah. No, then it's like a team approach in which a person is saying, this is what I want for myself, and the team says, maybe I can help you, or I can help you. And so almost this one person is known by several people, and it's like a conversation that happens.
Yeah. I think your practice is symbolic of a situation where you understand mental health in a way that it's not just simply handled by the psychiatrist, and it's not the entire healing of a person and their mental health is not going to be just by the doctor and the psychiatrist. There's a whole team that's needed. There's investment in nutrition and lifestyle and psychotherapy that's needed. And when you do all those things, then you can get to real healing of depression. So I think that's, for me, that's what your model shouts out. So I appreciate that. Yeah.
Absolutely. We found a lot of success with it.
Yeah. So I want to ask you now just about some of the newer modalities in mental health treatment. So there is, I know you do ketamine-assisted psychotherapy, and you also, you know about, I think, transcranial magnetic stimulation. That's another thing that people might be interested in, that has a lot of potential benefit and a lot of good let's say good evidence to suggest that the people who are resistant to other modes of treatment, medications and so on, may benefit from these modalities. So can you tell people a little bit about what ketamine is and what is the evidence behind it?
Yes, so ketamine has been, it's a fairly medicine that's been around for a long time. It was an anesthetic. People who were using this were also using it for pain control, and so it's been around for a long time. A lot of safety profile with it, and antidepressant effect to it as well. That is one of those things that got discovered, but it also has a very unique property of being a psychedelic. Mm-hmm. Not classic psychedelic, it's a dissociative, but it does give full-on dissociation and visions, and so it becomes a place where a person can actually explore their unconscious by the kind of things that they go through, and with the help of a guide or with the help of a therapist, they can start learning to listen to their inner intuition, which is the thing that is the biggest problem that the world imposes on us so much that we forget to listen to what do we want. What is our highest goal, highest truth? How do we want to manifest in the world? What do we want to do because of it? And that dialogue gets lost. So with psychotherapy, you can uncover that dialogue. And yes, the biological effect of the ketamine is great, that it can help with the depression. But while that is happening, it can be given so much more momentum by introducing this conversation with a person's own psyche.
Right.
That is going on all the time.
Yeah, that's fascinating. I think that it's really going down to the deep, deep roots of someone's imbalance and trying to address that, and going to certainly a deeper level than other medications can. So it's very good to understand more about that. And I know you're doing ketamine in Austin and in Lakeway. So, for folks that do have that requirement, then they have good access to that.
Absolutely. And this is just like any other, you can use medicine, you can use Prozac, right?
Right.
Or you can use ketamine, right? But doing that with psychotherapy helps. Right. Like doing that with psychotherapy, that can help.
Yeah.
And then the skill of the psychotherapist, right? Like, have they done their own work? Are they medicine as well? Mm-hmm. Right. So you're combining all these different types of medicines.
Right. So it's just another integrative approach that you can take, and just a better approach for people with difficulty to treat depression. So I appreciate you telling us about that. So this has been such a good conversation, such an important conversation, I think, for the whole community to benefit from. So I appreciate you taking the time and educating us about depression and the various modalities around depression.
Of course. It was a pleasure.
Thank you.